Good morning, tribe. I hope you guys are having a fabulous Halloween. Sorry, I forgot my costume, and evidently Jennifer forgot hers too. We're talking to Jennifer today about case management and her ability to work from home. So we had several of you interested. I hope you guys are able to attend live. If you're not, watch on the replay and enter questions, and Jennifer can answer those after the fact. So good morning, Jennifer.
Good morning.
How are you today?
Well, good afternoon. I'm on the East Coast, so for me, it's good afternoon.
And we're also doing this at noon, which we hardly ever do. So yes, good afternoon. Good. What did you do prior to case management at home, and how did it prepare you for your current job?
So I went to nursing school. I graduated about 12 years ago, and I went when I was 35. So it was like a third career for me. When I graduated nursing school, I did my obligatory med surg for a couple of years, and then I transitioned into hospice. So I was a hospice nurse, which was also a case management role. So that gave me my first case management experience. And I did that for about 5 years. And then I transferred to an insurance company where I do case management, and I'm a certified nurse case manager.
Okay. So your experience in the hospice setting, was that inpatient or outpatient hospice?
Both. Mostly I did home hospice, but I did visit hospitals and nursing homes and things like that.
Okay, good. Just to give us a baseline of what your experience in the different settings were. So do you feel like your current role as a case manager is a good place for a new grad to start?
I don't think so as a new grad. I think I'm a believer that you need to kind of get your feet wet, and in my opinion, the best way to do that is med surg in the hospital. That's going to give you the huge variety of experience. So I think case management for a new grad would be difficult. People who come to our role, they come typically with some case management experience, or if they don't have case management experience, they have occupational health experience, they have rehab experience, they have long-term care experience. But that, doesn't necessarily have to be nursing. It could be that maybe they were a nursing assistant. I mean, it kind of all depends upon where you're applying. But I think it would probably be tough for a new grad. I think just some basic med surg experience would be a better idea.
Okay. So as a case manager, just give everyone a overview of what exactly that term in and of itself means. What's your role?
Well, a case manager actually doesn't have to be a nurse. Case managers are either nurses or social workers. To be a certified case manager, like I said, it's either a nurse or a social worker. So a typical day for me, and I did write down some notes because I thought that this might be a question. I work telephonically, meaning that I don't do any, person-to-person patient care. So it's a lot of review. I review and authorize or deny medications, durable medical equipment, stays at hospitals or acute or subacute rehab. I review a lot of surgeries, and we're viewing everything based upon evidence-based medicine. So we have disability guidelines that we look at, and any medication or piece of equipment we look at if it's appropriate based upon evidence-based medicine. We are, I work for an insurance company, so we are evaluating based upon that. Also, I specifically work in workers' compensation, so that has, in and of itself, that has different state regulations, federal regulations, things like that. So I have to kind of take all those factors and evaluate, medically speaking, if something is appropriate based upon all the different factors. And then I medically manage claims. So since I do workers' compensation, and I do complex workers' compensation. So if somebody has like a catastrophic accident where they're severely or significantly disabled, and it's expected to be long-term or permanent, that's when I would get involved, and I would kind of help coordinate all their care as the insurance company. So the insurance company, because it's a workers' compensation file, is paying for all their medical treatment. So as a medical nurse case manager, what I would do is manage and facilitate that.
Okay. A couple questions have come through from viewers. Someone says, I'm an LPN. Where can I apply? Do you guys hire LPN?
We do not. I don't know about the other insurance companies. I would just search. I found my job on Indeed.com, which I find to be a pretty good website for job searching. So I would just search some of the larger insurance companies. It's not just workers' comp that has nurse case managers. It's health insurance companies. It's auto insurance companies. It's all insurance companies. So I don't know if other companies hire LPNs. It's quite possible.
Okay. And then to be certified, is that a national certification or additional college courses or through your company?
Great question. It's a national certification, similar to all the other nursing kind of specialties that there are. What I did to do that, my company paid for it, which was nice. I took like a review class, similar to the NCLEX. You do a bunch of practice questions, and then you go to a testing center. I think it's like 250 questions. And then luckily I passed. So then I'm a certified nurse case manager.
That's awesome. Good for you. So what are the top 3 challenges in case management, and how did you overcome those? So your specific case management role as workman's comp case manager is a little different than other case management that you've done in the past. Can you give people like kind of an overview of what your job duties were maybe previously to doing workman's comp?
Yeah, and that's another great question. Workers' comp is definitely different for a lot of different reasons. You're dealing with a lot of litigation. So you have to kind of take those factors into play as well. A lot of times people are acting on behalf of what their attorneys kind of guiding them to do. A lot of times the workers, the patients are annoyed that they hurt themselves at work. They may feel that their employer's to blame for that. So there are a lot of kind of secondary issues besides whatever the medical disability they have. There's a lot of psychosocial issues that come into play. And that is really challenging. Another challenge is, since I'm working on the phone and I'm not face to face with people, and I want to say this the right way, but people aren't always, and this is not just because of what I do, but people are not always truthful. And I think it's a lot easier to be less than truthful when you're talking on the phone than when you're making eye contact with someone. So that's a challenge. Also, workers' comp, depending upon the state, people have motivation to be out of work. Sometimes their salary is 100% paid to them, their medical care is covered, and they don't have to go to work. So for some people, that's a motivation to continue to stay out of work. So we have to kind of take all those factors and figure out medically what's the most appropriate for them, and from a disability standpoint as well.
So you're kind of challenged with being the bad guy on occasion.
Yep, on occasion, I'm definitely the bad guy. A lot of times, though, I am the good guy because we can do really wonderful things. We modify people's houses. We modify their vehicles for them. We help put children through college for injured workers. We can offer, a level of care that they may not have access to. So a lot of times we're the good guys, but you're absolutely right. Sometimes and this is insurance companies in general, I don't think I'm speaking out of turn when I say that sometimes we're viewed as the bad guys, but
absolutely. But man, if you've got the right person on that end, you are such a great patient advocate when it comes to that case management as well, which is such a beautiful thing.
Absolutely. And a lot of what we do is we do a lot of teaching to our injured workers, our patients, but also teaching to the our coworkers, the claims associates that we work with, explaining to them what certain illnesses or disabilities are. A lot of times the injury might be straightforward, but the person may have a huge variety of comorbids that are impacting more than potentially the actual injury. So it's a lot of teaching and explaining medications, talking about side effects of medications. We really get to dive really deep with a lot of these issues. Right now, we're dealing with a huge amount of opioids, trying to wean people off opioids. We're sending people to pain management programs. We pay for it and send them to get them off the opioids that they've become used to. So it's a lot. There's a lot to it. There really is.
Okay. Another question came through. It said, sorry if this already been answered. I'm a new grad, RN, BSN. I've been working on a critical care unit. How much experience should I have before I apply?
That's a good question. I would say 6 months to a year. Critical care is going to be good experience, and that's going to be really appreciated. So I would say I think it's always 6 months, just in general, especially for you new grads. A year is kind of like the benchmark when employers are looking. They like to see that you stay with one employer for a year. So I would say 6 months to a year.
Okay. And can you tell us what a typical day looks like? You're working from home. What does that look like? Are you sitting in front of your computer the whole time, on the phone the whole time? What does that picture look like for you?
Both. I'm sitting in front of my computer on the phone. We have kind of high-tech computers where our phone is kind of through our computer via Skype. So we have, some meetings that we attend. I'm fortunate enough to work an alternative work schedule. So I work Monday through Thursday, 10 hours a day, and then I get Fridays off, which is pretty awesome. So it's a 10-hour work day. So, it's a lot of reviewing. It's a lot of sitting in front of the computer. I have to always tell myself to get up and walk around, take the dog out. It's great though for being at home, so I could do the home kind of chores like laundry and fix dinner and all that kind of stuff. People make them when people work from home, people make the mistake thinking that they're not going to get as much work done, and it's been proven across all industries that it's actually the opposite. You end up doing more work because you're comfortable, you're home, you just kind of end up pushing through and working a lot more hours.
The statistics say your level of productivity is so much higher in a home setting than in a work setting.
Absolutely. Yeah, you don't have the distractions. I do go into the office occasionally because I do work within a team environment. And I like doing that from the social perspective. So it's a really nice balance to be able to work from home and in an office.
That's nice. Would you say that this is a high stress work environment?
No, not at all. Compared to the hospital, compared to hospice, it's very low stress. Since we're not doing any kind of direct patient care, the decisions that we make and what we analyze are very important decisions, but they're never emergent decisions. So there's not typically a huge amount. There's not a huge time pressure usually. The biggest challenge is triaging. So figuring out which is the most important thing I'm working on at any given time, because most likely I'm working on like 30 things. I typically have a file assignment. I have 50 files that I follow at once. So at any given point, multiple things can be coming up, and I have to constantly figure out, okay, which is the most important thing to do at this moment.
That kind of leads into the next question. What are the characteristics that make a nurse successful in your area? And I think prioritizing sounds like one of the big ones.
100% prioritizing good people skills, good customer service skills. Our customers are our patients, but also the companies that buy the insurance policies. You have to kind of be mild-mannered, not get too, overly emotionally involved. I mean, it's all the basic skills that you learn in those first couple nursing jobs that you have, really.
Sure. Jennifer has another question. She says, is your home computer with all the requirements provided by your employer?
Yes. So they provide a laptop, they provide double monitors, they provide all of the modem kind of things that go with it, all the headsets and everything I need so I can set up a home office. In fact, they require it. You have to have an official home office. They don't want you to be kind of sitting at your coffee table working. They want you in an office.
And I think, does the door on your office have to lock or something? They have to know that that is the secure area, essentially?
Yep, it doesn't have to lock. There has to be a door that closes.
Door. Okay. Good question, Jennifer. I was going to ask a question that came to mind. When you stepped away from the bedside and went completely corporate, were there any fears or hesitations on your part? And how did those iron out throughout your experience in your current role?
That's a really good question. To be quite honest, I still have those fears. Eventually, I think part of me does want to go back to clinical nursing. I would love to go back to hospice. And the longer I'm out of clinical patient and direct patient care, the harder it's going to be to get back in. So I would say to alleviate that, I stay very involved in nursing organizations. I'm very involved in my nursing school alumni organization, so that I constantly kind of still have my hands in more typical nurse environments.
Good for you. Yeah, and I mean, I don't know if that will ever go away for you in terms of like, oh yeah, I'm washing my hands of the bedside completely. But once you're a bedside nurse, it's really hard to think in your mind, I might never step back in here.
It's very challenging. It is. You're absolutely right.
It's great that you're staying up to date because, as you know, healthcare changes so rapidly. So what's your favorite tip or trick in your role as a case manager?
I didn't hear the first part. My favorite what?
Trick or tip in terms of like staying organized, or is there any trick that you have that you'd like to share with us?
I'm a big to-do list person. So my trick is, and this was the same when I was in the hospital, taking report, kind of doing the S-bar list. I'm a big list person with the little squares and then checking it off. And I constantly, like, here's my notebook. I use the notebook and kind of turn page after page after page and keep the notebooks forever so I can always go back to them if I need to.
Nice. And then what do you love most about your role currently?
I love the people I work with. I love that this job gives me the flexibility to work 4 days a week, no weekends or holidays, work from home. That's probably what I love the most, the flexibility and the work-life balance.
That's awesome. I know there was lots of interest, and you've already mentioned that you work for an insurance company. Do you want to share which one, if you have current positions available?
I'm happy to. I work for Liberty Mutual. It's a national insurance company. They may or may not have insurance in all the different, or offices in all the different states, but it's a great company to work for.
Okay. And do you guys all work from home, all the case managers in your area?
We have the choice. Some people don't want to work from home. Some people work 50% home, 50% office. You have to be associated with an office. So my office is only, 15 miles away. And then once you're there for like 6 months, then they give you the option of being able to work from home if that's what you're interested in.
Okay, great. 6 months is totally attainable, you would think, for the ability to have that freedom to throw a load of laundry in and come back and work, and throw another load of laundry in and come back and work.
Yep.
Yeah, that's great. Especially if you have a family, I could imagine that would be really helpful. So we're coming to the end of our time here with Jennifer. So if you guys that are viewing have questions, go ahead and get them in so we can answer them before we close out. But what is the hardest part, do you feel like, of your specialty?
The hardest part is not being face to face. I'm very much a people person, so it's a challenge for me not to have the physical contact with my patients.
Sure. Sure. But all those other positive things outweigh what the face-to-face contact.
Right. And it's what everybody says of the beauty of nursing is that you can have, 15 different careers all in one. And once you're, maybe feeling a little bored with one thing, you can do something totally different, which is, I think, the amazing thing.
Absolutely. That's so great. Thank you for giving us some of your time today, Jennifer. It doesn't look like there's any more questions coming through, but if people do ask you questions and I notice them, I'll kind of tag you and make sure that you see them on our Q&A once it's posted live to or posted for replay on the Tribe page. So those of you that are stuck in a rut and not enjoying what you're doing, I would challenge you to seek out a different area of nursing. The options are absolutely endless, guys. So thank you for being here, and you guys have an awesome Halloween.
Thank you. Happy Halloween, everybody.